Thank you all for joining us online today for our new Maitland Hospital Virtual Open Day. I'd like to start with a traditional welcome to country by local Wonnarua elder, Uncle Richard Edwards.
Nian Maruku Parang Wian Wonnarua Miramalikan Paraani Parakupa Najan Nayan Maru Wian Narakai Parapa Urakai Kal Panakal Nachan Kupaka. We acknowledge the Wonnarua people, traditional keepers of this land, and we pay respects to their elders past, present and emerging. Welcome to the Maitland Hospital. Nian.
Good afternoon again, and again welcome to our Open Day. My name is Narelle Bromelo and I'm the Health Infrastructures Project Director for the new Maitland Hospital project. It would have been wonderful to have held this event in person. However, thank you for playing your part in minimising the risk of COVID-19 transmission and joining us online instead. We know that Maitland and the surrounding Hunter Valley region is one of the fastest growing areas in Australia, expanding at the rate of one family per day. Of course, as the population grows, so does the need for more healthcare. The $470 million new Maitland Hospital has been built to provide care for the community of Maitland and has been future-proofed so that this may continue for many years to come. On behalf of Health Infrastructure, I would like to say I am so proud of what we have delivered in partnership with Hunter New England Local Health District and the many other stakeholders involved, including you, the people of this region. Seeing the new hospital come to life from the ground up has been an exciting process. Planning began 10 years ago and an enormous amount of work has been done to make sure we built something that provides the right level of services when it opens, but also has the capacity to serve the community long into the future. I am very pleased to tell you that the new Maitland Hospital will begin to welcome patients early next year and will be providing you with an update on this in the coming weeks. The Maitland region has a rich cultural history. It is Wonnarua country with hills and plains, lakes and wetlands, all prevalent during traditional times. This country is home to many cultural sites, sand engravings, stone quarries and artefacts. And it is also home to a highly significant landmarks for local and surrounding Aboriginal tribal groups, including God Biami's Cave and Mount Yango. The site where the hospital now sits was once the Turton Brickworks, an industry with a long history in Maitland. Turton bricks were used in many important civic buildings as part of the early development of the town. Brickmaking continued on the site until 2006, and in 2017, work to build the new hospital began. We knew from the outset that the design of this hospital must respect this long-standing connection to the community, and it was something that was really important to us. The team established strong relationships with key organisations and people, including Maitland City Council, Minda-River Local Aboriginal Land Council, the Maitland Health Committee, local schools, Rotary groups and healthcare providers, to name a few. Throughout the build, we invited groups to site, held pop-up stalls in Maitland and engaged in consultation and information sessions to keep that conversation going. And all of this is reflected in our new hospital. As you arrive to the site, a 75-metre long arbour on the facade of the building welcomes you to Wonnarua country. The design on the arbour was created by artist Soretta Fielding in a collaborative process with Minda-River Local Aboriginal Land Council, local elders and community. It features Aboriginal symbols and totems that are connected to country and signals it as a safe place for all the community seeking care. Walking into the foyer, you are surrounded by one of the largest paintings in the Hunter Valley. Designed by artist Peter Poulet, it draws on stories collected from locals and is an abstract representation of the Maitland area, the river and surrounding landscape. In other parts of the ground floor, you will also see various artworks that represent a collected memory of the past, current and future Maitland Health Service. This unique approach to honouring the important role the hospital has played in caring for the community for more than 175 years has been designed with support of local heritage experts who have brought a wealth of experience in art, history and storytelling. We've also made sure that spaces are named in not only English, but also in local language, and visitors will be able to scan QR codes to hear the correct pronunciation of Aboriginal words. But of course, beyond the way it is designed and looks, the way it works and cares for its community is paramount. Before I hand over to our next speaker, I would like to congratulate all those who have been involved in building the new hospital. In particular, I would like to thank our project managers, CBRE, our construction partner Multiplex, and of course the planning and infrastructure team from Hunter New England Local Health District. The hard work, dedication and real commitment from each member of these teams has been instrumental in delivering this wonderful building. I commend you and hope you are proud of your new hospital, a pivotal piece of infrastructure for this community. Thank you so much, and I now hand over to Michael DiRienzo, Chief Executive of Hunter New England Local Health District, to talk more about what you can expect from the new Maitland Hospital.
Thank you, Narelle, and welcome everybody this afternoon. First, I'd like to acknowledge that we are here on the land of the Wanneroo people and pass my respect to elders past, present and emerging. And again, very sorry that unfortunately COVID has prevented us from doing the event in person. But like so many things impacted by COVID, we've found a way to present this to you online. And I'm really pleased that we'll be able to join you today in this particular format. Building a hospital that we support the community needs now and also into the future is a very complex process, and has been even more challenging because we've had a few years of COVID throughout that process as well. But just to recap, each of our facilities is supported by a clinical services plan. The plan makes sure that we provide the right level of healthcare at the right time, and we analyse a lot of detailed information about patient admissions that have been recorded over a long period of time. And then we look at local, national and global trends in disease to help us predict those future needs, as our hospital is here today, but also for the future. Our clinical service plan then guides what we do and the decisions that are made as part of the project. The result is a hospital that is uniquely placed to serve the people of Maitland and the Hunter region, and I'm sure you'll get the opportunity and you'll be very proud of it. As Narelle said, we began planning for the new hospital more than 10 years ago. It's very exciting to think that we'll be welcoming patients early next year, and patients can expect the same level of excellent care that has been provided to them for more than 175 years. But these will now be delivered in brand new, modern and much larger spaces. Our inpatient rooms feature a mix of 1 and 2 bedrooms, each with an ensuite, large windows with an impressive view of the area. There are expanded facilities for surgery, for emergency medicine, for maternity, for paediatrics, for renal dialysis, oral health and outpatient clinics. There is also space for a new 12-bed chemotherapy service, which will be commencing in the new year. And I now invite you to take a look inside by watching our virtual tour. I think you'll all agree it looks really wonderful, and our staff are now hard at work getting ready for the move. We will start by bringing our existing services across to the new hospital. Once we've settled in and everything is running smoothly, we'll start to scale up as demand requires. We're also exploring options for where we locate our community health, mental health services, including the new site. And we're excited about this transition. But it's a big task, and there's a lot of teams involved to ensure that it all goes smoothly. This will be a staged process, but in reality, it will happen quite quickly over 1 week. Comprehensive plans have been developed and are now being refined. We will test these so that every scenario is considered and there's no interruption to patient care. During the week that we move, we will ask the community to help us by only attending the new site if medical treatment is required, so our teams can get familiar with their new surroundings. More information about Move Week will be provided to you in coming weeks. Once it is opened, you'll be able to get to the hospital by public transport or drive with more than 800 parking spaces available when you arrive. I've been advised that Transport for New South Wales will provide information about bus timetables before Christmas. And when the transition is complete and services have been transferred, the existing Maitland Hospital will be decommissioned and closed. However, it's important that we pay respect to the existing hospital and the important role that it has played in caring for the community for more than 175 years. Our staff will have the opportunity to bid the existing hospital a fond farewell. The Maitland Regional Art Gallery is also hosting a special exhibition to honour the hospital. Historical items and new artworks are on display until February next year, and I really encourage you to visit before it closes. This transition from the old to the new hospital is a truly momentous occasion and marks the beginning of a new era of healthcare for the region. I'm confident that this new facility will allow our medical staff to provide the best possible care for our patients, and I'm very proud of what we have delivered. Thank you to all those involved, and we're now available to answer any questions.
Thanks very much, Michael. We've received many questions in the lead up to today, and we're so happy to answer these. We are joined today by Dr. Ramsey Awad, Liz Smith, Jake Howell and Christine Osborne from Hunter New England Local Health District, as well as Kirsty Gill from the project management firm CBRE, and John Jones representing our construction partner Multiplex. Also online is Peter Cooper from Health Infrastructure, who'll be helping with this part of the session. You are welcome to ask more questions in the Q&A section of this webinar. If we don't get time to answer all your questions today, we will email you a response in the coming days. We're also recording this session and it will be made available on our website after today. Thank you very much for joining us, and I'll now hand over to Peter, who will moderate the questions coming through.
Thanks, Narelle. Our first set of questions are for you, Michael. Question number one is, when will the new hospital open?
We're on track to open in early 2022, and we'll provide more information about the move date in coming weeks, but very soon, not far away, and as early as possible next year.
Thanks, Michael. The next question is, will there be jobs available at the new hospital?
Yeah, as I said earlier, we'll start by transferring our existing services across and then scale up as we need to. So our priority is to move the old hospital, lock, stock and barrel, into its new facility. And then as part of our clinical service plan that I mentioned earlier, we'll be building enhancements and those additional services required moving into the future. So you will see more positions coming online in coming years.
Michael, what is happening with Cessnock and Curry Hospital?
Well, it's very exciting because just recently we heard the government make a commitment to Cessnock Hospital. So we'll be receiving over $111 million as part of New South Wales Government's $500 million investment into regional rural health. So right now, there are no changes to the current services that we provide at either Cessnock or Curry hospitals. But we're excited with the opportunity that that investment now brings with it Cessnock. We do look at our network of services on a regular basis, but at this stage, our focus will be on looking at what we'll be developing at Cessnock, and no changes to Curry at the moment.
Thank you, Michael. Dr. Ramsey, what happened to the existing hospital?
Thanks, Peter. Sorry about that, everyone. The existing hospital. So we do have a few community services, both mental health and regular community services, that are going to remain on the old Maitland site for a period of time. We're working now on plans to relocate those services. In the interim, though, we're going to consolidate those remaining handful of services into one part of the hospital from an operational and security perspective. Ultimately, though, we will be vacating the site, and the site will be handed over to Property New South Wales, who will manage a process which includes community consultation and engagement in terms of the future use of that site.
Thanks, Ramsey. Have you installed solar panels?
I can happily say yes, we have. It wasn't part of the original project scope, but over the life of the project, we're able to incorporate that. So when you do visit New Maitland Hospital, you will see one of our large car park areas have some wonderful covers or roof covering that's been put on there in a Y shape. They are actually solar panels that will be providing a large amount of power to the new hospital. So we're very excited with that piece of infrastructure, and it comes on top of the large solar panels at the John Hunter, and a number of other hospitals will follow shortly.
Thanks, Ramsey.
Thank you, Peter.
Liz Smith's also online, I believe, and I think probably you're best to answer the next set of questions, actually. Will the new hospital have a mental health unit?
Yes, it will. The new hospital includes a mental health unit where patients will receive specialised mental health care, and it has some additional spaces to the existing Maitland Hospital in terms that it has a sensory modulation room and a gym incorporated into the design.
Thanks, Liz. We've got a lot of questions about parking. How many levels of car parking, and how do we pay for it?
There's 3 separate areas of car parks that are all on the ground level. In total, Michael's already mentioned that there's more than 800 car spaces, and the charges for the parking will be the same as they are at the current hospital at the $4 per day.
Thanks, Liz. Will there be an emergency button in the morgue for family members who become distressed and may go into cardiac arrest?
There's a duress alarm and a telephone in the viewing room for ringing the emergency number, and families in this space will always be escorted by staff. Emergency buttons are generally used in clinical areas, so the duress alarm and the telephone provide that option for raising an emergency in the mortuary.
And will there be cafes at the new hospital?
Yes, there are 3 retail spaces at the new hospital that include varying sizes and offerings, and they're currently being fitted out.
Thank you, Liz. The next set of questions are all about our move, and I think, Jake, you're probably best to answer those. The first question is, how many patients will be moved, and will they all be in ambulances?
Jake, you're on mute. We can't hear you.
Sorry, muted in 2 places. So thanks, Peter. Yeah, look, the exact number of patients that we move on the move day will be determined in the days leading up to the move. Obviously, anyone that requires hospitalisation will be safely moved across to the new facility. Based on our number projections, we're looking at somewhere between 80 and 100 patients. And yes, look, we have organised a special patient transport arrangement that include varying levels of critical care arrangements to make sure that all our patients will receive high quality care during their transfer.
Good to hear, Jake. How did you plan for the move?
Thank you. Yeah, good question. Look, we've been undertaking a lot of comprehensive planning in the last few months leading up to Christmas, that considers a range of factors like how many staff we're going to need to undertake the move, how many patients we're going to have in hospital, as I mentioned, and as well as any other services that we need to care for our patients on the day, including food and cleaning, for example. We've also been doing some testing of our plan to make sure that we've considered all the different things that can happen on the day and have appropriate contingency plans in place to make sure that we can manage any situation that may arise.
Thanks, Jake. How will you make sure that our patients are cared for while the move is happening?
Yeah, so there's going to be quite a comprehensive process around assessing each patient prior to them being moved, and they'll be moved in various streams using our existing policies and procedures around how we move patients, which is something that we do in healthcare every single day of the week, move patients from different facilities. So some patients will be assessed as safe to go with patient transport officers, others will be with trained medical staff, nurses, right up to like our intensive care patients who will have a nurse and a doctor go with them for every move.
And Jake, one more question there for you. How will staff be ready to work at the new hospital?
Yeah, so the new Maitland Hospital project team have undertaken a comprehensive training and orientation program. We're currently working through that now, and we'll continue to right up until move day to make sure that all of our staff have been over to the new hospital and have had a look around, have received their orientation, have done their fire education, for example, as well as we've developed a suite of training videos that take staff through the new pieces of equipment, for example, that we have in the new hospital.
Thanks, Jake. A lot of those questions were submitted prior to our session. We've got a couple of other questions now in the chat function, and I'd like to remind our participants that if you do want to submit a question, please do so in the the Q&A section of your Zoom meeting. The first question is about the new helipad, and does this mean that Maitland will start taking trauma and air patients? Liz, would you like to answer that one?
Yes, I can answer that one. No, it doesn't mean that Maitland will start taking trauma patients. John Hunter still remains the trauma referral centre for the district. So it will be, I guess, more used for like the NETS retrievals that come for the babies and specialised, taking out specialised specialties that we don't have here at Maitland, so further abroad like Sydney for spinal or burns patients.
Thanks, Liz. Will the support services at the old hospital be transferred to the new one, in particular GP access?
Yes, GP access is part of the new build, and they're incorporated in the outpatients department and be accessible after hours.
Thanks, Liz. We've probably only got time for one more question, I'm sorry. What happens at the moment, given the COVID cases? What happens if there's a high number of COVID patients needing care? How will that be managed?
Happy to jump in there, Peter, if you like.
Sure.
So as part of our move day preparations, obviously COVID is front of mind, and we're considering that as a contingency for how we'll manage the move. So what we'll have to do is continually assess the COVID situation as we approach the move day, and that will form a basis for our decision around how we move, which patients we move first. COVID patients, for example, would be moved after all the patients who don't have infections would be moved, and it will also help us inform how many patient transport vehicles and the type of transport vehicles that we require. So this will be assessed, you know, in the 2 weeks prior to the move, essentially on a daily basis. So we make sure we reach the right level of resourcing to get the move done safely.
Thanks, Jake. We're just out of time, but I do want to thank everyone for attending today. It's not your last chance to ask questions. You can visit our new Maitland Hospital website, and there is a section there around submit your questions. Any of those that we haven't been able to get to today will be responded to via an email in the coming days. We'll also make a list of all of the questions available so that people can see them. So please stay up to date by visiting that website, and the address is on your screen. Thank you again, everybody, and have a happy and healthy Christmas. Goodbye.